All right, everybody, good morning. Thank you for joining today's media briefing. We'll go ahead and get started. My name is Robert Barsanti, Public Information Officer with the California Department of Public Health. First, this call is on the record, and a recording of today's briefing will be available after the call, so that will be made available to all of you. Joining me today are Dr. Erica Pon, the California State Epidemiologist and CDPH Deputy Director with the Center for Infectious Diseases, and Dr. Annette Jones, the State Veterinarian and Director of the Animal Health and Food Safety Services with the California Department of Food and Agriculture. Both Dr. Pon and Dr. Jones will make some opening remarks about the current state of bird flu for this briefing, and then we will have time for questions. You can submit your questions using either the Q&A feature on Zoom, or we will take live questions later using the raise your hand function. So with that said, at this time, I will turn things over to Dr. Pon to get us started. Thank you.
Great. Good morning, everyone. Thank you so much, Robert. First, I just want to give you all an overview of our state's overall response to bird flu, starting with our statewide efforts and our One Health approach. California has been taking swift and comprehensive action in response to the detection of bird flu in dairy cows across Central and more recently Southern California. We've been demonstrating a strong commitment to public health, worker safety, and a One Health approach where we consider the coordinated response across animal, environmental, and human health. We've had experience managing poultry outbreaks together since 2022, and we've gradually been increasing our preparedness since this past spring. The state is prioritizing our mitigation efforts, raising public awareness, and providing resources to those at highest risk. On Wednesday, the governor announced a state of emergency. This is part of a targeted, proactive action to ensure our government agencies have the resources and flexibility we need to respond quickly to this outbreak. The emergency proclamation allows for expedited contracts, expending hours for certain staff and responders, and increasing emergency hires. More simply, the state of emergency declaration allows us to expand our workforce to continue to monitor closely and respond to the situation nimbly, helps us mitigate disease in animals, protect those at risk, and ensure we continue to learn about this bird flu virus and be prepared if things change. Our California Departments of Public Health, Food and Agriculture, Fish and Wildlife, Industrial Relations, Cal-OSHA, our Office of Emergency Services, as well as our Labor and Workforce Development Agency are leading a coordinated effort. This includes multilingual outreach to dairy and poultry workers, targeted social media campaigns to promote preventive practices, and media outreach like this and interviews to keep the public informed. Our priority and key initiatives include education outreach, along with distribution of personal protective equipment, or PPE. We work with local health departments to do farm worker health checks and timely testing and treatment if needed, and robust surveillance of infected areas. To shift to focus on the public health aspects, the overall risk to the public remains low. 35 of our 36 human cases in California are the direct result of exposure to infected cattle. We still have not seen any evidence of human-to-human transmission in California or the US. The confirmed case without exposure to infected dairy cows was a child in Alameda County. The child had no known animal exposures, and the source of this case is still unknown. There's been no evidence of spread to others. All of the child's contacts had completed monitoring, and all contacts with symptoms were tested negative. The child and family members also tested positive for other common respiratory viruses. To date, we've also conducted extensive outreach on bird flu and protective gear in partnership with CDFA, other state agencies, and many organizations who work with farms and farm workers. We have distributed more than 4 million pieces of PPE to protect California farm workers from bird flu. This protective gear includes respirators, high-quality masks, goggles and face shields, gloves, and caps. We've also been monitoring close to 5,000 individuals with potential bird flu exposures, and based on those exposures and symptoms, over 130 individuals have been tested, with just those 36 mentioned earlier testing positive. All of those individuals have been offered treatment, while other individuals in close contact or with suspected bird flu have also been offered treatment. Our public health network includes 16 public health labs across the state that can test for bird flu in humans, and California requires all clinical labs to submit influenza A test results, including subtyping, and we are seeing a significant proportion of those labs conducting that subtyping, which supports our robust enhanced flu surveillance for H5 and novel influenza. There are also 2 commercial labs up and running that can test for H5, and more are working on it via CDC contracts. California also has the largest wastewater testing and monitoring system in the nation. This system includes 75 sites capable of testing for bird flu, and more sites are doing influenza testing and surveillance. We have ongoing outreach to our healthcare provider community, including updates during monthly ground rounds, health advisories, and we just hosted a call this morning with key healthcare partners to update them on bird flu in California. Recently, after bird flu was detected in raw milk samples, the state secured a voluntary statewide recall of raw milk and cream products from that product. Pasteurized milk and pasteurized dairy products continue to be safe to consume, and pasteurization is fully effective at inactivating the bird flu virus. As a parent and a pediatrician, I am grateful for pasteurization and always recommend pasteurized milk for my family and my patients. We're all continuing to learn together about this bird flu virus, and this proclamation helps California be even more prepared if things change. Thank you, and I'll turn it now to Dr. Jones.
Thank you, Dr. Pan, and a big thanks to the members of the media and others that have joined us today. I know there's a lot of questions about our statewide effort in California, and it's really nice to be able to tell you a little bit about what CDFA is doing. CDFA, the California Department of Food and Agriculture, our primary role is to focus on animal health as well as food safety. So in this event, we're focused on eradicating bird flu on two different fronts primarily. One is on poultry farms and the other one is in dairies. The responses are similar in some ways, but different in others. The primary approach for each is a state veterinarian quarantine and disease control zones to limit the movement of animals, products, and equipment. However, it diverges a little bit after that. The virus is severe and highly contagious in poultry. It's basically a death sentence for a poultry flock. Also, the virus is well studied in poultry, with experts from around the world agreeing on the best methods of disease control. When we make detections in poultry flocks, we move quickly to euthanize the birds to both ease their suffering and to reduce the risk of spread. The virus is less well understood in cows, given that it was first discovered only last spring in Texas. But we know it doesn't impact their health as severely as it does poultry, so our response is different. For cows, we focus on containing the virus while infected herds recover, and we do that similarly, as I mentioned, using quarantine orders. But there's a lot we do not know about how this virus behaves in cattle, so we're also conducting about 40 significant research projects, most of them funded by USDA. There is one important research project that I really want to bring to your attention, and Dr. Pan mentioned it. Early last summer, FDA re-verified that pasteurization is 100% effective in killing this virus in milk. So the first thing that happened are infected cows are pulled out of the herd. That's my helper there. Infected cows are pulled out of the herd and put in special areas on a dairy where they can recover. And but besides that, even if there's a cow that was milked that perhaps isn't showing sign of disease yet, pasteurization is 100% effective at killing this virus. So milk continues to be both nutritious and safe to drink. So just taking a turn to look at some numbers is on the dairy and poultry side. So far on this incident, we're testing every single dairy farm in the state. So primarily we focus on the negative dairy farms, and there's 984 dairies in California with about 1.7 million cows on them, and we test those weekly. Unfortunately, the virus we're finding moves very quickly from between dairies. And since the initial introduction into California in August, we've established quarantines at 679 dairies. Most of those are in the Central Valley, which is kind of our agricultural rich part of the state. But we have just recently detected a few infected dairies in Southern California as well. The state quarantine that we place on these dairies restricts movement of higher risk cattle and also requires enhanced biosecurity. And biosecurity are those actions that a farm would take to try and prevent the movement of virus on or off the farm. So things like gloves and masks for people and clean clothing, vehicle disinfection, equipment disinfection, and the movement controls on cattle. So that's the bad news is the number of farms that are infected. But the good news is that 66 of those farms have gone through a series of tests to demonstrate that the virus is no longer present on the farm. And we have over 100 that are going through that testing process because they're hopeful that the virus has been eliminated from their farm as well. On the poultry side, poultry flocks, unfortunately, are at risk both from mostly migrating waterfowl, so ducks and geese and swans that migrate south. This time of year, they're mostly migrating north to south. Those birds are known to carry highly pathogenic avian influenza and that can spill over into our poultry flocks, our domestic poultry flocks. But also the strain that we're finding in our cows can spill over into our poultry flocks. So currently, just this fall, this is the third wave of infection since 2022 that our poultry flocks have experienced, and the first time they've gotten virus from cows as well as wild birds. So just this fall, we've had 51 farms, commercial farms affected with the virus and 9 backyard flocks in 13 counties. The commercial farms include chicken, turkey, and duck farms. The recent surge in the past, when we've had these surges of infection, they tend to be seasonal, kind of like human flu. We see it most commonly in these winter months. So in closing, I just want to say how important the cooperation of both our state and local government partners, but really the cooperation of our farms and ranches and veterinarians across the state has been as we work together to try and tackle this new virus in cattle and not quite so new virus in poultry. Thank you.
Awesome. Thank you, Drs. Pon and Jones, for your opening statements. At this time, we will be taking question and answers. So feel free, like I said, either raise your hand and we can go ahead and call on you and unmute you. You can use the Q&A option as well at the bottom of your Zoom screen. We will start with a question that we've been getting fairly often. And Dr. Pon, I believe this one's mostly for you, but Dr. Jones, if you have anything to add, please feel free. But the first question that we have here is, how close are we to facing bird flu spreading from person to person?
Sure. So historically, we have seen limited human-human spread of bird flu virus in other countries. In all of those instances, that transmission was confined and not sustained. So far, there continues to be no evidence of person-to-person spread of this virus in the United States or in California. And this is why we and other public health officials are monitoring this closely. This is why we get specific sequence testing to look for any mutations and why we are taking these proactive actions to mobilize our resources if things change. We're still learning more about this virus, as Dr. Jones mentioned as well, and we'll continue to keep everyone updated as we learn more, and we want to be poised and ready if things change, and we'll continue to provide updates.
Great. Thank you, Dr. Pon. Another question that we've gotten here in the chat. So just close the close the window. A question about the virus affecting poultry eggs specifically. Does pasteurizing eggs kill the virus the same way it does in dairy?
So there's kind of a good news, bad news story there. The good news is the eggs that you would find in a store are perfectly safe. The reason is that any poultry flocks show signs of disease very quickly. Cows may be asymptomatic for a number of weeks, but chickens, they usually show signs of disease within days and they have high mortality rates. So we're able to ensure that eggs from infected flocks do not enter the market. And it would be rare anyway to see that kind of vertical transmission from a hen to the egg.
Great. Thank you, Dr. Jones. Another question, Dr. Pond, I think this one might be for you again. How many illnesses have we seen reported by folks who've consumed possibly H5N1 tainted raw milk? How many tests had we performed there?
Sure. So far, we received about around 12, to my knowledge, reports of illness, and to date, none of those have been confirmed to have H5N1. We had a few that had seasonal flu, and then we had that one case that I know there was a lot of interest in a child that had consumed the recalled milk who had influenza A, but the detection was at that borderline of detection and the levels were very low, so we were not able to determine whether it was seasonal flu or bird flu.
Thank you. Dr. Jones, we'll go back to you now. A couple of questions. How is the virus currently moving between dairies?
So there's what we're really trying to focus on is what we do know about how the virus can move between dairies. And what we do know is it can move between infected cows, particularly cows that are lactating. The virus has it likes the cells in a mammary gland. So if a cow is lactating or producing milk, or a cow that's just about to calf, so she has a nice full udder, those cows are particularly at risk of moving the virus if they're infected. But also contaminated equipment moving between farms, or if employees or service providers are tracking mud between farms. Those are very common ways that we're seeing it move. Or trailers, livestock trailers that maybe weren't cleaned between animals entering and exiting them from different farms. There's also a lot of the research is to look for what factors we don't know. So why else is it moving between farms? And that's what the research is really targeting.
Thank you. We're going to go ahead and take, we do have a raised hand question here. So if I could come back here. Rachel, I'm going to go ahead and ask you to unmute your mic. And if you could go ahead and state your name and your affiliation and your question, be great.
Thanks so much, excuse me, for taking these questions. Rachel Bluth here from Politico. Few questions for you. First, how would you, for Dr. Pond, how would you rate our sort of readiness at labs right now? We've seen some reporting that there's not enough testing capacity, there's not enough workers. Has the state done anything to ramp that up? And then I have some others too.
Yeah, and I think actually there's probably two different components to that, and I'm happy to talk about the human clinical lab testing, and then I might turn over to Dr. Jones to talk about animal and herd testing. But for human clinical testing, again, a reminder that H5N1 is a type of influenza A. So there's a lot of testing that I was talking about earlier that happens for influenza A, and a lot of what we call subtyping, which really looks for, we do that all the time every winter season to look for, helps us know whether we have a good match for flu vaccine. So we have a lot of that capacity in the state of California. And we require, in California, we require that data to be submitted to us. So we have statewide awareness of the subtypes and seasonal flu that's circulating. And then there's a flag if the lab tests for flu and they find out, oh, this doesn't look like seasonal flu. And then that flags public health and we can help make sure it gets H5 subtype. I also want to re-mention the 16 public health labs that already do the H5 testing as well. So we have robust capacity, and flu A is a known entity. It's really that subtyping, but you can learn a lot just from the labs we already have testing for flu.
Okay, and just to add on from the animal side of the world, that where the testing is done at the California Animal Health and Food Safety Laboratory, primarily in California. That laboratory is managed by the University of California at Davis, their veterinary school. It has 4 sites throughout the state, but it's also part of a national lab network. So whenever we need surge capacity, we can access multiple labs in other states. Currently, we're actually using 5 different labs systems for them in other states to meet our testing needs. So there is still excess capacity for testing.
Great.
Oh, and I should add one more thing. All results are required to be reported. So even when we're using these other labs in the network, they electronically message the results to our disease response database so that we can maintain that knowledge of which farms are positive and which farms are negative.
Thank you both. We did get a question, and I thought it was important for you both to maybe speak a little bit about this, but what kind of protections are being taken for farm workers as they deal with H5N1?
I'm certainly happy to start. We have this has been our priority and our focus, and a huge partnership across not only statewide agencies, but as Dr. Jones was mentioning, with the farms and farm workers themselves, dairy and farm worker organizations to do education and outreach. And again, over 4 million pieces of personal protective equipment have been given out to farms and farm workers. So this has really, again, been our priority. And we're continuing to learn about and using a feedback loop of working with our organizations to get feedback on, how do we get more information? How do we get translations into the appropriate languages? And really providing materials that they can use and implement.
Thank you, Dr. Pond. We'll go ahead and we've got another good question here. If I can pull back the Q&A thing again. Recently there have been reports of house cats getting bird flu. I believe Los Angeles County Public Health put out a news release on this recently. What kind of concern or how concerning is this for human owners of these pets?
Sure. Yes. As mentioned, LA County has reported 2 domestic cats who have been confirmed to have consumed raw milk that was infected. And it's interesting, and Dr. Jones knows more about the feline sort of receptors, and we're seeing a lot of neurological disease in feline species with this particular virus. So we are, receiving reports of that are happening to local health departments. We just sent out, again, in collaboration with our Department of Food and Ag partners, but doing a veterinary advisory as well. And we want to remind families to not feed raw products to their domestic pets. So we continue to receive and investigate these domestic animals as well, and continue to collaborate with others on investigating those.
Okay, great. Dr. Jones, I think I've got one here that's more in your lane. Question from Stephanie Becker. When dairy cows recover, do they produce as much milk as they did before? Also, has there been reinfection of a farm after a herd has recovered?
Yeah, that's a very good question. One of the things that as these farms are starting to recover, that is really an area of focus for us. So we want to understand what a recovered farm looks like. We want to understand the pathology on the cow. We want to understand the long-term effects on reproduction. There certainly are indicators that there are longer-term impacts on these cows, even when they may appear to recover, but we're really going to probably need to wait for another milk cycle to see how they do. But it is a severe disease for cattle.
Thank you again. Trying to find a next question here. We've got, just keep closing. Sorry about that. I keep closing the question submission. Let's see here. Question from Anna Ibarra with Cow Matters. Other than avoiding raw milk, are there any recommendations for how the general public at large can protect themselves at this point?
I think I want to reassure people that the general public, the risk is low. Again, we're really focusing on those who are at highest risk, which are people working with infected animals, and why we've been focusing as well on education and outreach and providing personal protective gear. I think the only other tip I would remind people to do is to avoid touching or interacting with wild, sick animals or dead animals, and call your local animal control, but avoid those as well. And I just always want to take the opportunity to remind everyone to get up to date on your seasonal flu vaccine, your COVID vaccine, and we are here in winter respiratory virus season. Thanks.
Thank you, Dr. Pond. Question from Brenda Goodman at CNN. Dr. Jones, this is for you. She wanted to confirm the quarantine numbers that you mentioned. It sounds roughly like 2/3 of the dairies in the state have been quarantined. Is that accurate?
Yes, so we have released some, but we have just the most recent numbers just updated last night. 679 dairies. Some of those have been released, as I mentioned, 66 have been released. So the actual under quarantine right now is a little bit lower.
And then another question I think falls in on your side of things, Dr. Jones. Do we know what the mortality rate of cows has been? You see reported a lot, pictures of deceased cows and whatnot, but do we have any idea what the actual numbers for that are?
Yep. So the dairies do lose some of their cows to this disease. Generally, when they've experienced death loss, it's because there's other stressors. The cow might have a secondary pneumonia, or during the heat, we had a late heat wave this summer that added a little stress. Normally, the cows would have been okay, but then when they were dealing with bird flu, also they were dehydrated, and so the dairymen did report losing a few more cows, but the actual mortality rate from the disease is pretty low, 2%, maybe 1%. Whereas poultry, so when you hear and compare it, it's closer to 90, 100% of poultry. So while it does impact dairy herds, and it's definitely devastating to the herd managers, compared to how it acts in poultry, it's much less severe.
Thank you for that. We're going to jump back and take a couple of live questions again. Up first, I want to invite Apurva Mondavili, I believe. If you would go ahead and state your name, your affiliation, and then your question.
Thank you. This is Apurva Mandavili. I'm with the New York Times. My question is first for Dr. Pan, or Pan, I'm not sure how to say your name, but I just was wondering what you're doing to pick up on any asymptomatic infections among farm workers or among others, and also how you're working with CDC, as in how far are you taking the testing, and then at what point do you hand off to the CDC? And then I have a second question, but if you can answer that one first.
Sure. So let's see. To recap, the questions are about whether we're looking for asymptomatic infections or not, and then when do we do testing versus the CDC?
Yes. And if you're doing any serology, for example, for the asymptomatic, yeah.
So our lab is considering working on potential ability to do serology, but most of that serology has been focused on studies or specific cases. If we haven't, we always like to try to do that, especially if there's an unknown source or low levels of detection for certain cases. And to also answer a few of your questions, so our labs we have local and state public health labs. I mentioned there are 16 that can do the H5 testing. The CDC considers when they're positive there, they consider them a presumptive positive, and then the test goes to the CDC where they can do another test, and that's where they consider it confirmed. So we have had a couple cases where the levels of virus have been so low that by the time it gets to the CDC, it's not detected, and we've been calling those probable cases. Our focus has really been on removing barriers to people who do have symptoms so we can get them timely treatment, and focusing on that, as well as the robust enhanced flu network that we have here, again, with the required testing submissions and looking for clinically attended flu surveillance. I think the other interesting thing that happens with the human testing is that the kinds of testing we were used to that is easier sort of in the nose or throat is actually showing very low yield in our cases. So most of our cases really have only been positive when they've had an eye swab from their eye. And that is something that it's harder to implement and do and get acceptance of with people who don't have any symptoms. So that's really where we're getting the yield for the testing. And so again, we're really focusing on getting timely testing and treatment for those who have symptoms.
Okay. And then my second question was actually about wastewater. I know California's had a bunch of signals of wastewater. Have there been any that you have not been able to trace to an animal facility of some sort?
Yes, we actually have most of our wastewater sites are actually detecting H5 now, of the ones that are testing for it. And we do have many that, to your point, are in areas where dairy processing plants are discharging, and that's the likely source. And we've been looking a lot at this, and we are presuming at this point that a lot of the pasteurized milk that can be PCR positive, and again, we know pasteurized milk is safe. Any virus fragments in there are not infectious, but they can still test positive in the wastewater. And There are numbers out there about how much residential milk is poured down sinks. So we think actually a lot of our wastewater detections are actually just from even residential or other commercial milk dumping or down the sinks.
Okay. Actually, I have one really quick follow-up about what you said before about the presumed positives. You said there were probable cases. So are both kids that you found in California, are they both considered probable cases, or is one confirmed and one not, or where are you on that?
Sure. So the one confirmed case from Alameda County that doesn't have a known source was confirmed at the CDC. There was a suspect case that actually was even lower levels of detection here and even in our California public health labs. And by the time it got to the CDC, they actually didn't detect any flu A and couldn't also subtype it. But we did have flu A positive here, but we weren't able to tell whether it was H5 or seasonal flu. So it puts it in a category of suspect case.
Thank you, Dr. Pond. We're going to go next to Kate Wolf. So Kate, if you wouldn't mind your name, affiliation, and your question.
Hi, yes, Kate Wolf with Cap Radio News in Sacramento. I'm wondering, Dr. Annette Jones, if you wouldn't be able to talk about how um, this situation has strained or affected farmers in California. Just a little bit of a bigger picture look at that.
Sure. I'll kind of divide it up. So poultry farmers in particular are under a lot of pressure right now. And that's because I've already mentioned how severe this virus is to a poultry producer. And they have virus being introduced to their flocks. And poultry flocks tend to have pretty good, what we call biosecurity. It means they have barns and they have fences and they have car washes before you can come onto their property. But they're having virus introduced both from migrating wild birds as well as in other situations, even more commonly from dairies. Now, obviously, the cows aren't walking over and going into the poultry flock, so it's not moving via cow. It's and we're not exactly sure how it is getting introduced into the poultry flocks. It could be shared employees, which is discouraged. It could be shared equipment, which is also discouraged and would not be likely. Or it could be just proximity. So there could be, mice and possums and other critters that might be tracking the virus from one farm to another, just, on their little paws and fur. So, and it's definitely stressing our poultry farmers. It is very stressful when you have to depopulate an entire flock. Even though the intention is food, your goal is to raise healthy flock and healthy animals. It's very stressful when we just depopulate them. As far as dairies go, I think it took them by surprise because, they hear us always in the animal health world always saying this virus cows recover. It's not severe in cows, and that's true, but we're comparing it to poultry. But the dairy farmers that have had to deal with this disease are very stressed, and the cows do recover, but they usually don't quite bounce back to where they once were. And what has been described to me is it surprises them how quickly it spreads through their herd. Not every herd is the virus behaves differently from herd to herd, but sometimes they'll say, I went to bed with a couple six cows. We had our hospital area all set up to give them electrolytes, and I got up the next morning and half the herd was infected and sick. So it is stressful for them as well.
Great. Thank you, Dr. Jones. We're going to jump to another live question. Lisa, if you wouldn't mind, again, your name, affiliation, and then your question, please.
Yes, thanks. Lisa Creger at the San Jose Mercury News. So this is for Dr. Jones. So some of the dairies are frustrated that the current protocols don't seem to be stopping the virus or preventing its spread to farm workers. So, I wonder if this suggests unknown paths of transmission. And then I have a easy follow-up.
Yes, I have definitely heard how frustrated the dairies are. They've made, some of them have made very big changes to try and keep the virus from getting onto their dairy, and it still appears, and they're extremely frustrated. Like I said before, we know some of the way, we know for sure this virus can travel in a livestock trailer, via cow or just infected material. So, um, so we know those things, and that's what we've been focusing on with our dairies. But sometimes it seems like something else is causing the spread as well. Could it be a slip up? Someone skipped the boot bath when they walked on and they walked the virus on. Probably a lot of times there's a slip up. But that's what all those research projects are looking at to see, is there something else that we're missing, and do we need to change our tactic a little bit to try and slow the spread better? The
That's
other thing to
helpful.
keep in mind is just one more thing, sorry, but the scale of dairy in California is pretty significant. So there's 1.7 million cows in the state, and a lot of them are in the Central Valley. So just the scale and the fact that we raise our cows more outdoors than, say, some of the northern states where they might be in enclosed barns. So there's just movement and access, and they're connected. That's really leading to the spread.
Interesting. Thanks so much. And a quick follow-up, maybe this is for Dr. Pan. So it's interesting that they're the two different strains and genotypes, and I'm wondering if that would explain some of the different clinical symptoms we're seeing, conjunctivitis versus respiratory distress.
That's a great question. And again, I think we're all continuing to learn about this particular clade. And then, as you were mentioning, the two different genotypes that we're seeing primarily in dairy cattle versus from the birds. My understanding is that the receptors are very similar for this clade in general, regardless of which genotype, whether it's the D1.1 or the B13.3. But great questions that we're all continuing to learn and understand about.
Thank you both. I want to ask a question now from chat. This is from Katherine Ho with the SF Chronicle. Are you considering offering the vaccine to poultry or dairy workers similar to how Finland has done?
So the Federal Health and Human Services does have, they've been preparing some H5N1 human vaccines in the Strategic National Stockpile. Currently, they are not releasing those, and I think we are all, again, wanting to be poised and ready, again, using kind of the tools we have and remaining proactive if things change. But our current understanding is they're not releasing that with the current no evidence of person-to-person transmission. And thankfully, again, we've been seeing mild disease here in California. So we're reliant on the federal government for that.
Great. Thank you, Dr. Pan. There was another question here that I think, Dr. Jones, this one is for you. And this comes from Brenda Goodman again from CNN. But with so many dairies impacted, is this currently, or do we expect this to affect the milk supply?
That's definitely a question we had early on too. And so we've been working with we have contracted with UC Davis, they're one of their economists, actually a group of economists, to look at that, look at the potential impacts on both the milk supply and as well as poultry. Because the virus is kind of moving from dairy to dairy, not every single dairy is really heavily impacted at one time. Even if they're still under quarantine, usually the cows have recovered and they're kind of bouncing back on milk production. So early indications from that study is they don't expect any kind of a significant impact on the milk supply, but probably more to come on that. But it's looking good from what we've heard so far.
Thank you. Here's another question from the chat that I want to pose to you both. Probably Dr. Pan, more for you, but is there a potential for our human cases to become more serious? To date, most of the cases in California, if not all the cases, have shown mild symptoms, primarily conjunctivitis. But the Louisiana case, which has been classified as severe, might cause concern.
This is exactly why we are, have been preparing and monitoring. Again, so far they have been mild. We do know that historically other viruses, other strains of the H5N1 avian flu virus have had more severity in other countries. Again, so far in the United States, it has been mild, except in this first Louisiana case. We're, of course, watching closely along with the Canadian case. I think someone else here noted as well that those were both the D1.1 genotypes, so more associated with the wild bird or genotypes. And we're, again, watching closely. This is why we want to have this robust testing, do that sequencing, and again, mobilizing our resources, which again is part of why we've not only been working for several months on this, but are grateful for mobilizing more resources with this proclamation.
Thank you. I have another raised hand that I want to get to. If I can find my way back to our participant panel. Megan, go ahead and feel free to unmute yourself, and again, name, affiliation, and your question, please. Thank you.
Hi, thanks. It's Megan Multenny. I'm with STAT. I just have two follow-up questions for Dr. Jones. You said that cows can be asymptomatic for a number of weeks. Does that mean infection in the udder and like shedding into the milk, but without other discernible symptoms?
So what we're usually, no, what it means is, well, yes and no. So a lot of times what'll happen is on a dairy, they won't really notice any cow. Sometimes the first thing they see is like a little runny nose, and then their milk, they stop, they get a fever and they stop eating and drinking so much, and then their milk production really drops. And what we have found is if we do the milk testing, so now I mentioned we're testing, it took us a little while to get there, just the logistics of accomplishing it, but now we're testing every negative dairy every week. And if we detect a positive, it's usually before they see any clinical signs. So that's during that asymptomatic period. So one of the first things they see is virus shedding in milk, but we're picking them up very early now. But before, we were doing this proactive testing, and that's also one of the reasons, nationally they're rolling out more of a silo study across the whole country, because they can be, it's just like us. When we pick up a virus, generally there's a few days where we may be shedding virus, but we don't feel sick yet. Well, same with the cows. So the short answer is yes, that's possible, but the milk test picks it up before the clinical, it picks it up really early on in the infection.
Thank you. When did the state switch to doing all dairy testing once a week? I know there was a more targeted sort of geographically, strategy that was happening back in September.
Yep. And we actually just switched. So what we were doing is very astute of you. What we were doing was in the Central Valley, we were testing every dairy every week. It did take us a while to get there. We started by testing in the zones that we knew there was infection, and testing dairies that were linked to those areas through movement or common ownership. And then, so we really focused on trying to expand that testing to all of the dairies in the Central Valley. And, the milk handlers and creameries really have helped us do that by helping us get those samples. And then we started just doing prevalence testing in the North Coast. There's a lot of organic dairies and other dairies up there in the, anywhere from Sonoma, Marin, all the way up to Humboldt. We call that the North Coast region. And then in Southern California, there's also not a lot of dairies, but there are still some dairies down there. And we're just prevalence testing down there. In Southern California, the prevalence testing picked up a positive. I think, I don't remember the exact time frame, maybe 2 weeks ago. And so that triggered every dairy testing in Southern California. And we just figured, since we're every dairy testing in Southern California, let's do it in the North Coast also. So that was pretty recent.
Thank you, Dr. Jones. We've gotten this question from a couple of outlets. I see it here most recently from Leslie McClurg with KQED and Suzanne Rust with LA Times, but asking specifically about a possible federal shutdown. If that were to happen, would that have an impact on the state's response to H5N1?
I'll start from the public health perspective. We are lucky to have robust public health within our state, and our CDC colleagues have noted that they are also activated for a response and that they would be continuing to respond even if there's a federal shutdown as far as any technical assistance and lab testing.
Yep, and similar from the animal health emergency response perspective, we are very dependent and cooperate really closely with the U.S. Department of Agriculture, and we use their veterinarians and other specialists in the state all the time, regularly. And in prior shutdowns, they have been exempted, so we would anticipate and hope that they would be similarly exempted.
Great, thank you both. We've got time for maybe one or two more questions here. I think we've got one raised hand that we haven't heard from yet, so we're gonna go ahead and turn it over. Carrie, go ahead and unmute your mic, name, outlet, and question, please. Thank you.
Hi there. Thank you so much. This is Carrie Klein with Valley Public Radio. I had a couple questions about funding, really. So the first is just, is there a dollar value that is attached to the emergency declaration from earlier this week? And I was wondering if there are any efforts to provide more farm funding for farm workers who get sick. For instance, could there potentially be a separate bird flu sick leave, something similar to what we saw with COVID, in order to sort of incentivize farm workers to get tested?
I think currently we're really focusing on the provisions I mentioned in the beginning around expediting contracts and flexibilities with workers responding. But we are, again, working on sort of what else we can do to be prepared. So currently, it's really focused on those three provisions, and we will be keeping all kinds of things in mind and considerations for the way forward.
Great, thank you, Dr. Pon. We've also got in the chat, Brenda, I think we took a question in writing, but I see you have your hand up here now, so we'll go ahead and if you want to unmute your mic, Brenda, go ahead and again, name, outlet, and a question for Dr. Pon or Dr. Jones, please.
Hi there, thank you so much. I wanted to ask about the change of administration at the federal level. And how you're getting ready for that and how you're thinking about it. It sounds like the state has really kind of taken matters into its own hands to deal with the situation. But do you see that you're going to be that states are going to be more self-directed going forward, maybe?
I think right now in public health, we are really focused on prioritizing all the work that we're doing within our state. And again, we're really grateful that we can be leaders in that and that we have a robust system.
Okay, great. I think I know there are a lot more questions still in the chat and a couple of hands raised, but I think that is going to bring us to the end of our time here with Dr. Pon and Dr. Jones. Thank you very much, Dr. Jones and Dr. Pon, for your time and sharing your expertise with all of us. We have, like I said, a handful of questions still that were submitted in writing. We will go ahead and do our best to get back to all of you through our media team inbox. If you do have any other follow-up questions or you want to reach out to us directly, media@cdph.ca.gov is the way to do that. That's also where you can get the recording of today's briefing. So again, thank you all very much for your time and attending. Thank you to Dr. Pon and Dr. Jones, and we'll see you all again next time. Thank you.